Well, Bluegrass Ortho is proud to offer Mako SmartRobotics. It's the only smart robotic system that can be used to perform total knee, partial knee, and total hip replacements.
Dr. Kevin Denehy joins us with more. Welcome to the show, Doctor. We appreciate you being here.
Appreciate you having me.
Explain to us how joint replacement has changed as far as clientele, because it used to be just, we thought, old folks, right? Like people who had lived a long life and their joints didn't work anymore. But that's not the case anymore.
Absolutely. So I think 10, 15 years ago, the majority of people getting joint replacement surgery, they were in their 70s, 80s, and pretty sedentary. As we have this aging baby boomer population, people are more active, having sports injuries and things like that, that can lead to earlier arthritis. Patients are younger ages now. So the majority of people I see in my office are more in their 50s and 60s and 70s and 80s. And those people, after joint replacement, want to be more active than the sedentary people in their 70s and 80s for sure.
Absolutely. So what is the best advice for those folks?
Sure. So if you're suffering from joint pain, arthritis tends to make your joint stiff. It's hard to move around and difficult. But you want to be able to stay mobile and stay flexible throughout your joints. A lot of times patients can't go out for a 5-mile run because the knee hurts too much, and so staying active can be tough. Low impact activities such as cycling, bicycling, swimming, those types of things can really help keep your joints mobile, keep your muscles strong, and keep you at a healthy weight to not put too much stress across your joints.
I think people, anytime they hear the word robot, they wonder what that's all about. So explain what the Mako SmartRobotics does in different than what we've known in the past.
Absolutely. So it's interesting, the technology behind joint replacement surgery, how we put the parts in hasn't really changed in 20 years. The technology behind the implants themselves has changed a lot, but the conventional way we put in implants 20 years ago and today are really pretty similar. We make perpendicular cuts to the bone, and then usually the joint is somewhat deformed, so it's tighter on the inside or the outside part of the knee. And in conventional instrumentation, the way that we would fix that is to release some of the ligament. And the problem with that is twofold. It causes pain. Anytime you release a ligament, there's inflammation involved and patients have more pain after surgery, and it's imprecise, right? We're not able to, we're basing it on a feel. It's subjective. This feels tight, this feels loose. With this technology, what we do is we get a CT scan of the knee ahead of time, and then we map out the inside part of the knee during surgery. And so we're able to get these exact measurements of both the patient's bone anatomy and their ligamentous tension, and then we can make very small adjustments. And we're never able to be this precise with conventional instrumentation, but change things 1 degree, 2 degree, change things 1 or 2 millimeters, and then we don't have to do these big ligamentous releases of the knee, and the knee comes out very well balanced and better for patients.
This is just incredible the way you're explaining everything. Talk about the before and after. I mean, this is truly life-changing for these patients that come through.
Absolutely, for sure. And what we found with these robotic patients is that after surgery, they recover faster. They're taking less narcotic pain medication. They're off of their walker or their cane sooner, and back to doing the activities that they want to do.
Doctor, if people are sitting at home and they want some more information on how to take part in this and make their lives a little bit better, how can they do that?
Sure. I think the best thing for patients is really see your healthcare providers, right? If you're suffering from joint pain, you want to go in and see your doctor and discuss with them the options that you have available to you, and treatment options to be able to get back to the quality of life that you want.
Sounds like a win-win.
Thank you so much.
Yeah,
You're welcome.
Really
Pleasure.
appreciate it.